My name is Jennifer Hollington. I was diagnosed with ovarian cancer in 2020, and I'm now 3 years post-treatment with no evidence of disease. I wasn't aware of genetic testing before my diagnosis. When the pathology was done on the tumors that were removed during my hysterectomy, it was found that I had a mutation in the breast cancer gene, the BRCA2, and I was given the opportunity to have genetic testing to determine whether that genetic mutation was in just the tumor or in all cells of my body. I went through that genetic testing. It found that I did indeed have the BRCA2 gene mutation in all my cells, which means that I had inherited that mutation from one of my parents, and it means that I could have passed it on to my children. So, with the opportunity for genetic testing and with the determination that I was a carrier of a BRCA2 gene mutation, an inherited gene mutation, it opened up genetic testing for my family. So, many members of my family have been tested, including my mom. My dad had already passed away, but to determine what side of the family that genetic mutation came from. She's okay with my sharing her results publicly. I shared them in my blog. She did not carry that gene mutation, which means that the mutation came from my father. And that's important for our extended family to determine whether they might want to take advantage of genetic testing for themselves. I felt a little down for 3 or 4 days, and then I just concluded this is information I can use to protect my health, and it gives information to family members who can then avail themselves of genetic testing as well. So I feel good about the fact that my my knowing this result, my having had ovarian cancer with no forewarning in my part, uh, should there be other people in my family who also carry this genetic mutation, they can take proactive steps to protect their health and to reduce their risk of developing ovarian cancer, breast cancer, or other cancers where the risk is increased as a result of having a mutation in this BRCA2 gene. I think of myself as patient zero, the first patient in my family to discover this genetic mutation. And then other people, siblings, parents, children, can access this genetic testing and fairly quickly relative to somebody in the general population who does not have a first degree relative with a known mutation. Um, my children, my mom, my siblings all had a 50-50 chance of having the same mutation I had. So I know of other people whose lives have been saved or prolonged by virtue of a family member having developed a cancer, and through that and treatment for the cancer, the discovery that they had a mutation that then others could find out about and and take steps to protect their health. I think with such gratitude about all the people within the medical system who have supported me and helped me and serviced me and helped me along my journey. I think about all the family and friends who have been absolute cheerleaders through all of this. I'm grateful for the connections I've made through my blog, Genesis, where I've been blogging every day since 8 days after I was diagnosed with ovarian cancer in 2020. Uh, so I have a lot of gratitude for the support I've received and the fact that I'm still here. I'm here. I feel healthy. I feel strong despite everything that I've gone through. The one thing I would want people to know is that, yes, getting a diagnosis of cancer is very scary. In those first few days and weeks, maybe even months, uh, it's going to feel awful because the fear that I had and anyone newly diagnosed with cancer probably has is, am I going to be here? Am I going to see my children grow? Am I going to see, um, anything? Will I have a future? And the thing I would want people to know is, um, the statistics are in our favor. More people are surviving cancer and going on to lead healthy, happy lives. but don't forget to be healthy, to be happy in the moment while you are going through treatment. There are things to be grateful for always, that the support from the healthcare professionals, the just for me, one of the biggest things was the presence I had with my family. Before I was diagnosed with cancer, I was working 18 hours a day, 7 days a week, in part because of the nature of my job, and the pandemic had really made things quite crazy. And then once I was diagnosed, I was home, I was with my family, they were supporting me. So you can live a happy life during treatment. You don't have to keep looking forward to when treatment is over, I will feel better, I will be happier, I will all these things. I mean, yes, treatments can be quite challenging and difficult, but there's a lot of beautiful moments to be taken from it. And I remember reading early on in my cancer journey that you will never know how much you are loved than during the time you are diagnosed with cancer and treated for cancer, because people, they reach out to you and they want you to know how much they care about you. So that's a little perhaps silver lining. What I would want policymakers to know is that ovarian cancer is not a well-known cancer. It's not a common cancer. Only 1 to 2% of people with ovaries develop ovarian cancer. Many people have never even heard of it. Other people have heard of it, but don't know anything about it. I was in that category. I didn't know anything about ovarian cancer before I was diagnosed. Um, and as a result of that relative obscurity, it could be easy to overlook ovarian cancer. But I would encourage policymakers to think about funding for research. I am the beneficiary of a drug that was researched in the past, that was approved by Health Canada in 2016. So it's a relatively new drug still on the market. And that's giving me and other people hope that there will be treatments that will prolong our period without a recurrence. So let's I guess I would say to policymakers, don't forget about ovarian cancer.